Hi, Mrs. Jones. My name is Kate. I'm a Maria College nursing student. I'm gonna be taking care of you today. Can you just give me your full name and date of birth for me? And then Mrs. Jones, can you let me know, do you have any allergies? Mrs. Jones has given me her full name, date of birth. She says she has no allergies. And Mrs. Jones, are you in any pain today? Mrs. Jones is in no pain. All right, Mrs. Jones. When I did your respiratory assessment earlier, I heard rales and bronchi. So you probably have a little bit of mucus, which is normal since you're in the hospital with a respiratory infection. So I have some orders to do some trach suctioning for you. So I'm gonna start with that, and then we're gonna clean up your cannula after getting up all some mucus, okay? So I have my supplies here. While I'm checking on my supplies, can you just do some good deep breaths? Focus just on getting some breathing done so we can hyperventilate you. So while I suction, you know, I take away kind of that ability to breathe to clear up some mucus. So while I'm doing that, I've got my suction catheter kit. Let's see. So check my hands. I've got my suction catheter kit, I've got my sterile gloves, and I've got sodium chloride, which is on the order for me to irrigate my suction with. So let's see. I'm turning on my suction to 120, so it's a safe suction pressure. Open up. So now let me do my gloves. I'm going to set myself up for over here. I have my sterile gloves on. I don't need the sterile gloves that are in here. I'm going to pick up my suction tubing. This with this. I've got my clean hand, my dirty hand. So, let's see. All right, Mrs. Jones, are you feeling all right? You took some good deep breaths for me, which I saw. So I'm gonna go down with this catheter. You're gonna feel, you might like you have to cough. Just go ahead and cough, it will help me get out everything, okay? So I'm gonna be going down. Met some resistance, I must be at the carina, so I'm gonna just suction up. All right, perfect, Miss Jones. I'm gonna clear the tubing, take some good deep breaths for me. All right, I'm gonna go down one more time. All right, met some resistance. I'm gonna pull back up. All right, Mrs. Jones, how do you feel, all right? No pain after, right? Mrs. Jones says she has no pain. All right, Miss Jones, let me get this done for you. Turn this off. Let me get rid of all my this away. Gonna clean my hands. All right, Mrs. Jones, and following this, I would do another respiratory assessment to make sure that Mrs. Jones' lungs are now clear, or at least they sound much better than they did before. And that Miss Jones is in no pain, which is a good sign. So Miss Jones, now what I'm gonna do is I'm just gonna clean up your trach collar. I need to change the cannula because you're due for it, and also to the little, the split gauze underneath to keep your skin from breaking down, okay? So I've got my trach care kit, got a towel drape, and I've also too got my sterile gloves, which I'm gonna be using. All right, so I'm gonna start off, get my hands done, and then, I will need also too my sterile water for my cleaning, which is what I'm gonna put in my tray. So, we're gonna put the gloves over there. We're gonna start with my drape. Let's see. Okay, I found my edge that I can safely grab from. And pick that up. I can put that to the side. Let's see. Tracing my edges, got that 1-inch border to keep myself safe. Okay. Then gonna put this down. Okay, got my table set. Gonna open up my tray now. I can safely dump everything. Gonna put my tray to the side. I'll fill all 3 containers with normal saline. Perfect. And now I'll put on my sterile gloves. Let's see. There we go. Okay. So I've got my sterile gloves on now. Let's see what I've got. I've got an old tie kit, which I do not need. I'll take 2 of my gauzes and dip them in. Take another gauze and dip it in. Take my split gauze there, my Q-tips will be in here, and then I'll put my spoolie to clean the inside of the trach. I don't need these items. And then the last thing I'll do is I'll bring over my trash can. All right. Okay, Mrs. Jones, the first thing I'm gonna do is I'm gonna take out your cannula and I'm gonna give that a clean, okay? So I'm gonna pop it out, put it in my water, take my little brush. I'm gonna clean it, make sure I get it. I'm gonna hold this, take the spoolie, clean the inside of the trach. Once that's done, then I'll dip it in some water again and make sure. So that's good. So now I'm going to put this back in. And I'm gonna make sure I hear the click that it popped in, which it's good now. So now what I'm gonna do is I'm going to take 1 gauze, clean the top, throw it away. Take the second gauze, clean the bottom, throw it away. I'll pull out the old sponge. I'm gonna take 1, clean the top underneath the plate. And then clean the bottom underneath the plate. And then I am now just gonna change that split gauze underneath. Just slide it up under. Sure, that's good. All right. So Mrs. Jones is now all set. Her trach is changed and cleaned. So I'm gonna clean up my supplies. And Mrs. Jones, are you feeling all right? No pain? Okay, great. Mrs. Jones has no pain. She feels good. She's got her trach changed. And now that I've done trach care and trach sectioning, I'll go into her chart and document that I've given her care and that she is set until the next time that I need to do trach care. Thank you, Mrs. Jones. Her bed is locked and in the lowest position. She's got the call bell in reach, and Miss Jones is aware that if she needs anything, she can press the call bell and I will come back to help her out.